Assalamualaikum to everyone, welcome back to my YouTube channel. Today I am going to discuss with you some pathological gait. Before starting my content, we want to know what is pathological gait. Pathological gait is a several pathologies affect the neuromuscular and musculoskeletal system, and it may also affect the gait pattern. Causes of pathological gait have abnormal gait. Abnormal gait have pain, range of motion limitation, weakness or paralysis, neurological issues, LLD or deformity. Lateral trunk bending means the patient leans or bends the trunk towards the supporting side. Phase of gait are stance phase, single limb support. Lateral trunk bending possible causes are hip pain, hip abductor weakness, hip dislocation or abnormal hip joint, wide walking pace, unequal leg length, and other causes. Posterior trunk bending means the patient hyperextend or move the trunk backward. Phase of gait is heel strike to left stance. Posterior trunk bending possible causes are hip extensors weakness, hip extensor spasticity, or hip flexors weakness during early in swing phase, knee ankylosis, or spasticity during early in swing phase. Genu-valgum. Genu-valgum means the excessive tibial abduction refers to lateral deviation of the distal tibia from center of the knee. The distance between the feet is greater than at the knee. Phase of gait, stance phase. Scissors gait. It results from spasticity of bilateral abductor muscle of hip. One leg crosses directly over the other with each step like crossing the blades of a scissors. Example is cerebral palsy. Circumduction. Circumduction means the limb follows a laterally curved path or swing outwards. Phase of gait, swing phase. Circumduction possible causes are involved limb, relatively longer, hip flexors weakness. Equinus gait. The patient will walk on his toes. It is known as a toe walking. Other causes may be compensation by plantar flexor for a short leg, minimal leg length discrepancy, moderate leg length discrepancy, severe leg length discrepancy. Cerebral ataxic or drunkard's gait. Abnormal function of cerebellum result in a disturbance of normal mechanism controlling balance, and therefore patient walks with wider base of support. The more wide of base of support, the more deviate of center of gravity. This results in irregularly swinging sideways to a tendency to fall with each steps. Hence, it is known as railing gait. Short suffering or festinate gait. Normal function at basal ganglia are control of muscle tone, planning and programming of normal movements, control of associated movements like reciprocal arm swing. Typical example for basal ganglia lesion is Parkinsonism. Because of rigidity, all the joint will go for a flexion position with spine stooping forward, places the center of gravity anteriorly. Hemiplegic gait with spastic pattern of hemiplegic leg, hip into extension, adduction and medial rotation, knee in extension, ankle in drop foot with ankle plantar flexion and inversion, which is present during both stance and swing phases. Hence, the gait is known as circumductory gait. Foot drop or slapping gait. This is due to dorsiflexor weakness caused by paralysis of common peroneal nerve. There won't be normal heel strike. Instead, the foot comes in contact with ground as a whole with a slapping sound. So it is also known as slapping gait. Hence the gait cites another name, stepping gait. If you like my YouTube video, please subscribe my channel.